In this story, there are examples which can be broadened from the particular and from which we may be able to derive practices to benefit our populations. The years 2008 to 2014 frame my mother's journey from frailty to extreme frailty with multiple long-term conditions: multiple emboli, deep vein thrombosis, hypertension, cholesterol, type 2 diabetes, Parkinsonism, and other health debilities. The GP's decision to refer my mother to the Department of Clinical Gerontology at King's was crucial. King's have had her under their continuous care since early 2009. Multiple conditions are complex and they interact, but with the guiding hand of clinical gerontology, my mother has experienced a journey of superb therapeutic care, symptoms and medication management, and an enhanced quality of life. So, pound costs sterling to the NHS? Well, the cost of outpatient clinical gerontology, sometimes called medicines for older people, or there are different names. Pound sterling costs had my mother not been under the care of clinical gerontology. Well, I would have pressed the emergency button. I would have called 999, and I'd have done so many times. That I didn't was only because I had access to trusted expert advice from King's, in whose judgment my mother and I had confidence. So costs were avoided for the NHS. There has been only one single ambulance call-out and an A&E admission in almost 6 years, and no inpatient admissions. I have been my mum's self-appointed care coordinator. I took my cues from clinical gerontology on what to do about nutrition, physiotherapy, occupational therapy, exercise, etc., etc. Without King's permission to make a judicious call to them or send them an email, I dread what might have happened. My role as carer has involved connecting up the bits of the system between GP practice, lab, hospital department, whose IT facilities do not speak to each other, often due to fragmented contracts. So I have personally had to copy her blood test results, take them in an envelope by hand to the hospital. IT is a big part of the integration work being undertaken by Southwark and Lambeth Integrated Care. Another problem of integration of care was the difficulty of access to care wherever hospital transport was required. Hospital and other transport issues are still not geared around the needs of frail older people. So in essence, what gerontology has achieved is to give just the right holistic advice for my mother's care. What the system has still to be able to do is to coordinate all of that. I have taken on that role. I am able to do so. Not everyone can. As my mother's end of life nears and the journey of frailty to plateau to more extreme frailty progresses, so the way in which we express outcomes of care must change. Must change to emphasize therapeutic care, dignity, comfort, and alleviation of symptoms. It is now no longer about cure. My mother's needs were met in this regard when she became a resident of the Little Sisters of the Poor, a non-profit care home in Lambeth. The Little Sisters live the ethos of compassion, respect and dignity. We see it in their leadership by example. We see it in their careful selection and training of their workforce. So my mother, now totally bedbound, without speech or movement, lies in her special bed in her room. Spotlessly clean linen and clothing are changed every day. Her room and the whole building is fresh, clean, cheerful and peaceful. There is careful, continuous, respectful attention to every tiny need and detail. My mother is turned every 2 hours, and there is not a pressure sore in sight. Last month, the Professor of Clinical Gerontology at King's paid a second and I believe a last visit to my mother. Were a photo to have been taken then of the Professor, of my mother's new GP, of the senior care worker, nurse at the home, my mother and me, which of course it wasn't, you would have seen holistic in action. The handover from acute to the community is now complete. Continuity of care has been assured. My mother's life is ending gently, peacefully, painlessly. £1 cost to the NHS? Clinical gerontology. A little GP time and remarkably few medicines. £1 cost saved. There is no large shopping bag full of medication. No ambulances. No admissions. No death in hospital.